All right, we're ready. Donna, I'm going to turn it over to you.
Well, good morning, everyone. Or I should say good afternoon on the East Coast and good morning on the West Coast. Welcome to Mitigating Safety Risk in a Time of Pandemic. My name is Donna Ennis, and I am the Director of the Atlanta Minority Business Development Agency, or MBDA, Business and Advanced Manufacturing Centers. We know that this is a really challenging time for many of us in the country and in the world. The COVID-19 pandemic has swept the entire world, causing many of us to have to shut down our workforce, our workplace, and to figure out what we were going to do to keep our workers and our employees safe. Mitigating Safety Risk in a Time of Pandemic is a webinar that will help you navigate the challenges that you will meet as your workforce returns back to the office, to the work site, to your manufacturing plant. We know that many of you have stayed open during this time, and that those of you who have and those of you who have workers returning are doing some of the major basic things that we're doing during this pandemic: washing our hands, making sure that our employees wear face masks, figuring out how to reconfigure our workplace for social distancing. But we have experts here today from Georgia Tech Safety, Health, and Environmental Services Group to tell you even more. We're going to do a deep dive today on how you can mitigate the safety risk in a time of pandemic. So as we get started, I would like to first always thank our federal supporter, the Minority Business Development Agency, and our corporate sponsors, EBCO and Train Technologies, for helping to support our critical efforts here. The MBDA, or the Minority Business Development Agency, operates a national network of 30-plus centers across the country, all designed to help grow and strengthen minority-owned businesses. MBDA is a 50-plus-year-old federal agency, the only one established to help and grow and strengthen minority businesses. We are the agency is funded out of the Department of Commerce, and as I said before, we operate over 30 centers and special projects. Here's our mission here at the Georgia Tech and nationwide, is to help MBEs experience significant growth, create jobs, retain jobs, be sustainable, and really to, at the end of the day, have a positive economic impact on our communities and the nation. At Georgia Tech, our MBDA centers are part of the Enterprise Innovation Institute. This is Georgia Tech's oldest, this is one of the country's oldest university-led economic development groups. The Enterprise Innovation Institute has been around since the late 50s, and today we operate 12 major programs designed to build and strengthen businesses, industries, in our communities. Our Atlanta MBDA Business Center was launched in 2004, so we're over 15 years old, one of the top performing centers in the network. And we launched our Atlanta MBDA Advanced Manufacturing Center in 2016, dedicated to building a national center that taps the ecosystem for minority or MBE manufacturers. We do host a national MBE Manufacturer Summit each year, which we'll talk a little bit about later. But we are excited today to bring you this information. We're excited today to help you help your employees return safely to the workforce. Here are our impacts. Our centers operate in 4 buckets. We help companies secure markets and opportunities, help you source and acquire capital. We did quite a bit of work with our clients around the Paycheck Protection Program, or PPP, as well as SBA's EIDL during this pandemic. We want to help you build capacity in infrastructure. We consider today's webinar as an example of helping you with your infrastructure, as well as helping you to access the myriad of resources and expertise that's not only available in our center, but it's available at Georgia Tech and in the nation. Just quickly, our overall impacts: our centers alone have helped our companies secure over $3.5 billion in contracted finance. So if you multiply multiply that by the 30 plus centers around the country, you can see how much of an impact our MBDA centers have on our companies and on the communities around the country. Our current centers have served over 20,000 minority-owned businesses and helped create or retain 6,500 jobs. Here's our illustrious team of people dedicated to our causes. Anita Davis is a business advisor, and Jennifer Passy, who's a business advisor. They are contractor. Anita is with Praxis Strategic Solutions. Jennifer is with Sky Capital Ventures. Both of these ladies are dedicated to helping our companies source capital. Aisha, who's on the line today, is with Special Events. Jamarcus King is with JNF Alliance, is helping us with our Next Tech program. Lauren Roberts, our program specialist, and Asha Morton is our marketing and events coordinator. And finally, we have Brandy, but not least, we have Brandy Nagel, who is our program manager for the CARES Act Assistance Program. We'll talk a little bit about later, as well as our manufacturing center. And with that, I'm going to turn the program over to our two speakers today from the Georgia Tech Safety, Health, and Environmental Services Group. We have Brandon Philpott and Sean Castillo. Both are industrial hygienists with what we call our SHE's group here at Georgia Tech. And with that, guys, you have the floor.
First off, I'd like to say good afternoon to everybody, and I would like to thank Donna and the entire MBDA team for hosting this event and inviting us on to participate in this event. So as we begin this presentation, and we're talking about COVID-19, and some of the things we're going to discuss today is we're going to describe close contact, because I'm sure you guys have heard many times in the news what close contact is. And now we're going to describe it as what the CDC calls it. We're also going to give some strategies that can be used to minimize the impact of COVID-19 pandemic in your business. We're going to also define risk assessment related to the business environments and employee roles. We're going to list some recommended measures to reduce the risk of employee exposure. And we're also going to discuss community and non-occupational exposures and mechanisms to minimize exposure. So as you see in the news, by looking at the news, you see that the cases are continuing to rise of COVID-19. And as you look at the chart that's provided by the CDC, you can see the majority of the country have at least 40,000 or more cases in their state. So that just shows you that the impact that the work that we're doing is important, because the cases are still rising. So we still need to protect all employees while they are in their workspaces to help to try to reduce the spread of the virus. So exactly what is close contact? According to the CDC, close contact is when you're within 6 feet of an infected person for at least 15 minutes. And that is 2 days before the onset of that person's illness, or if you're around an asymptomatic person, that is 2 days prior to their specimen being collected. So you want to be sure that you know if you are aware of somebody that is affected, you want to make sure that you isolate yourself, and you want to monitor for symptoms. And then you also want to really avoid people who have higher risk for severe COVID-19 related illnesses. And then if you were to develop symptoms, you want to follow all CDC guidelines, whether that is, like I said, self-isolation, and then and you also want to make sure that if you want to get tested, you also get tested just to see if you contracted the virus from that person or not. So when we think about the continuity of business, we want to talk about risk assessment. We'll talk about risk assessment and seeing what the risk is of being around a person, the risk of the environment. You want to talk about reducing the risk of employees' exposure. You also want to think about strategies related to the plan that you will come up with to help reduce the employee exposure. And most importantly, you want to have employee involvement. Employee involvement is the key aspect of it because employees are doing the job task, whatever job task, and they know how to do it. You want to have their involvement to see how that job can be done, also while making sure that they are protected. And then you want to know what your community connections are. How do you know how to get in contact with the local health department or government officials? Do you know who to contact if you require additional supplies that you need? Prevention, you want to think of ways to prevent COVID-19 from shutting down your facility. And you want to review and update plans because information is forever changing about this. So your plans should be always reviewed and updated continuously. And you want to always use the sources that are out there. The CDC is a great source to use to get everything that you need. So when we think about risk, risk is classified into 4 different levels. You have very high risk, medium risk, and lower risk. Your very high risk is exposure to high concentrations of known suspected sources of COVID-19. So more like your medical professionals who are the frontline workers and working with people who have the virus. And your high risk are high potential for exposure to known or suspected sources of COVID-19. Maybe some of your doctor's offices or your dentist's offices, and you have minimal exposure risk, and they require frequent and close contact within 6 feet. So the businesses where you're not able to establish that 6 feet distance, the social distancing rule, you can classify yourself as minimal risk and lower risk, and you have no frequent contact, and you're able to achieve that 6 foot rule. So as a business owner, you have to assess and see where your employees fall on this scale. And depending on where your employees fall will dictate of which measures or how many measures you need to put in place in order to protect your employees. So when we're doing exposure risk assessment, employees are critical, as I spoke before. You want to assess for each task that they do. You want to determine how close the employee needs to be to other workers in order to continue their work or the customers that they service. So if they're able to achieve the 6 foot rule or not. So that's why it's always key to involve your employees in on this, because they can give you more knowledge of how a task is done, because sometimes owners are not always on the floor, and so they may not see exactly how the job is done in the employee's eyes. So it's always important to involve employees in your risk assessments. And you also want to work with a whole team just to get ideas from different people in different areas, because one part of your facility may be at a higher risk than the other part. So it's always important to involve many different people to get the outlook for different people. You want to know how much public contact do your individuals have, because it's one thing to limit it. If you have a business with just employees, it may be easier than to have the public coming in and out, because you never know. It's harder to control in that aspect of it. And do you have employees that need to leave the business for deliveries? I worked with a company where they were delivering food to the people who could not get out. And what are their exposures? You want to think about what are their exposures when they go out to the community, and then could possibly bring something back to your facility. And then, as I said, you want to see how often the public visits your business, because you never know what someone else is bringing in to your facility. As I've been saying, it's important to collaborate with employees on the assessment. Like I said, they know what they do and they know how to do their tasks. So it's very important that they have that input to know that they are protecting themselves as well as protecting everybody else around them. And then whenever there's a change or add in service, you should reassess your plan to show that that change has been made. So some people may be familiar with the hierarchy or controls, and some maybe not. But in the world of health and safety, we live by the hierarchy of controls, which are elimination, substitution, engineering controls, administrative controls, and PPE. Elimination is the control that you could do. Eliminate the hazard. If it's possible to eliminate the hazard, you want to eliminate the hazard. But with COVID-19 and it being a virus, it's almost impossible to eliminate that from your facility unless you have all your employees working from home. If that is possible, that's what you should do. You should have all your employees working from home and practicing social distancing. But in most cases, that is not feasible. So you want to look at the different options and go down the scale. So you want to think about some engineering controls that you could use as far as involve changes with the work environment to reduce work hazards as engineering control, or you want to think about some administrative controls and work practice controls. So work practice controls, you want to say that have reduced the frequency of exposure by social distancing. That's a huge work practice controls, because remember in the beginning we said close contact within 6 feet. So if you can, for at least 15 minutes, if you could try to space people out as far as possible, that is also a good control, because it reduces the amount of time people are within the direct presence of another person. Administrative controls, you can say by doing staggered scheduling. So let's say you run 2 big shifts. You may want to think about adding a 3rd shift on to reduce the amount of people that are in the facility at one point in time. And then last but not least, you want to think about PPE, which includes clothing and other work accessories designed to create a barrier against workplace hazards. But with that being said, PPE should be your last option. PPE is used as a last resort. It should not. PPE implementation of PPE should never be the first thing that a company goes to. You want to go through the hierarchy controls and see if you can eliminate the hazard. If you can't, you want to engineer it out or have some type of administrative controls to reduce the hazard. And then if all else fails, that's when you put the employee in PPE, because PPE generally makes the work harder. And for some people, they will not be able to complete their job if they have to wear a respirator per se. So you want to always look at other things before you jump right into putting an employee in PPE. So steps that employers should do to reduce hazards. So one thing, you may want to revise your sick leave policy. And that can be because, let's say if you have a really strict sick leave policy, and employees feel that if I miss work, I may lose my job. So employees may force themselves to go to work even if they are not feeling well, and which can possibly harm your workforce even more, because they can affect many people, and you have more people off, causing a bigger a reduce in your workforce. So if possible, you want to adjust it so employees they know that if I stay home, I'm not going to lose my job. And also, you may not want to require a sick note from the doctor, not only because they may not want to go to the doctor, and in certain instances, it's not as safe to go to a doctor's office. And then those doctors don't need to necessarily be treating patients that don't need to be there, because if a person feels that they need a sick note, they're going to go to the doctor, and that can just increase their exposure when it doesn't have to be. And it can also relieve the medical system, which is overworked at this present time. And you also want to try to stagger work shifts. As I said before, add an extra shift if possible. Have the least amount of people to complete the job as possible in the facility. And if possible, downsize operations and do smaller tasks where the facility can stay open, but it's just not as grand as it normally is. And if you can achieve social distancing at work, achieve it. One quick tool of employees to see if they're too close or not, if they were to stretch out their arms, each arm is about 3 feet, depending on the person, but if 2 people stretch out their arms and they're touching the fingertips of their neighbor, then typically they are too close to each other. So that's a quick tool that you could use to see if people are too close together or not. And then you also want to cross-train workers because if you have one worker doing one job that no one else in the facility knows how to do, that person will feel obligated to come to work or that job is not going to get done. So you're going to have multiple people that can do any job just in case that person needs to be off and should be staying home because they are suspected to be infected or infected with COVID-19. And also you want to promote some safe practices, as in the proper way to wash your hands, etiquette about proper way to sneeze, either the bend of the arm, or me personally, even before the pandemic started, I typically sneeze within my shirt to keep the majority of my germs to myself. So you want to keep enforcing it and trying to promote safe and healthy etiquette. And you want to provide plenty of trash receptacles in your facility, because the worst thing that could happen is someone uses a tissue or napkin to sneeze in and they don't have the proper place to discard of that. And that's just sitting on the workstation and it possibly contaminating the workstation and other people who are to come by that workstation and touch anything. So you want to have plenty of receptacles that people can easily discard trash. And you want to really discourage, if possible, people using the same workstation. Let one person use that workstation throughout the day, and then you disinfect it at the end of the day or in the morning. But the workstation should be disinfected between people using the same workstation. And most importantly, you want to talk about hand hygiene. Right now, you see it's a big push of washing your hands, the proper way of washing hands with soap and water or alcohol-based cleansers. You want to really try to demonstrate the proper technique, whether it's showing videos to your employees. Even though it seems small, it helps so much a proper hand hygiene. So either having videos or in your restrooms, posting posters and signs of proper ways to wash your hands. And you want to make sure you have materials and supplies that are easy to access to any work area. So plenty of hand sanitizer stations. But sometimes I learned about this in a consultation that I was doing a couple of months ago, that the hand sanitizer stations can be a hazard, because if they're in the middle of the facility, it could possibly cause a trip hazard. So you want to make sure that while you are protecting against one thing, you're not creating an additional hazard for other people in another way. So you also want to monitor compliance. And you just really want to stress the importance of this, even though people are getting back to the normal way of life, you still want to really try to enforce that we're still in the midst of a pandemic, and you need to do everything possible that you can do to help reduce the spread of the virus. And these are just some of the posters that I'm talking about that you could post in your restrooms or anything, proper ways to wash your hands and hand hygiene etiquette. So sometimes that people will wear gloves as a way to help combat the spread of the virus, but you really want to make sure that if your employees are wearing gloves and that they are aware of what gloves are and the purpose of gloves. So if they should be aware that just because they have a glove on, it's not protecting them against everything. They should really be controlling what they touch and what they don't touch. So if they have gloves on, they should not be touching their personal cell phone, because whatever is on the glove can be transferred to their cell phone, contaminating that, and then later possibly contaminating themselves with the virus. So you just really want to really train your employees on the proper etiquette of how to wear gloves. And most importantly, once you take the glove off, you should always wash your hands with soap and water or alcohol-based solution. But so there's nothing beats soap and water in my eyes. So you, if possible, you want to keep the 6-foot rule. And as I said before, the stretching out the arms, that's an easy technique to use. And then you want to see, it may not be achievable in your business to have the practice social distancing. So in that case, you will have to go to other measures, as you see maybe some grocery stores are using to help protect their employees from being infected. And as far as engineering and environmental control, you want to, I don't know if you guys are aware, but there's a lot of studies coming out that there's a possible link between the spread of the virus and using the air handling system. So you want to make sure that your HVAC systems are up to date and functioning properly, because a lot of times the HVAC systems do not have the ability to rid the air of the virus. So you want to make sure that at least it's up to date and working properly. And as I said before, you want to install physical barriers if you aren't able to practice your social distancing. As you see in the grocery store, they have the plexiglass up, and pretty much any store you go into, Zaxby's, anything, they have a plexiglass between the public and the person just as a barrier. Oh, excuse me. And then you want to encourage cleaning of work surfaces by employees every day, whether it's the computer, their workstation, they should disinfect it at the end of the day. And especially if they're sharing it with someone, between people, the workstation should be disinfected. And you want to also, if you can, control the entry and egress of your buildings. One of the grocery stores I visit, there's one way in and a one way out, because they want to make sure that people, when they're coming in, they're adhering to their policies to enter the store, so that you can better control that. So you also really want to control the aspect of who's coming in your facility and how they are, whether they have their mask on or anything like that. So administrative controls, you develop policies that encourage ill employees to stay home. Like I said, adjusting the sick leave policy will encourage that. Support less face-to-face contact between employees and meetings. So you want to have, if possible, you want to have web-based meetings, or how we're having this right here, through all web-based applications, just to try to reduce the need to be within close contact of someone. Encourage flexible work arrangements, so the telecommunicating or flexible work hours to reduce the number of employees on any site. You want to make sure that your IT has the capability of supporting that. You want to be really open and share information, updates, and procedures with your employees. Make them know that you are doing everything possible to protect them, and that you want to have communication open. Don't leave them wondering what my company is doing for me. You want to make sure they're informed and have them involved in the planning of this. And maintain a forum answering questions and addressing employees' concerns. Later on, I'll get more into this, but you want to have the message coming from one person, because if multiple people are saying the same thing, by the time it gets to person 5, it's a little bit different. So if you have everything coming from one person, you can maintain of how your information is given out to your employees. If you have any type of changes in your plan in your business, you want to notify your customers of how that they need to access your building, whether it's wearing a mask, if the signs of if you're sick or believe or you have showing symptoms of COVID-19, please do not come in. Those things, they're small, but they can really help. And you want to necessarily limit the access for customers. So do the drive-through, but you see many restaurants are using our back to dine-in options. So you really want to be careful about that and make sure that everything in your facility is up to date and well, and your air handling systems are well to help rid the environment of the virus. But like I said, a lot of air handling systems do not have the ability to remove the virus from the air because the particles are so small. And you really want to work with your employees to identify new ways to conduct your business, and your employees are going to be the first ones to know how to get that done. So as I said, you want to avoid close contact. You want to keep your work surfaces clean. Discourage the use of sharing phones or computer desks or workstations if possible. Minimize the crowded situations, like some businesses conduct safety meetings at the beginning of the day. You may not want to do that, or do that in a way that everybody can be spaced out. So you have a lot of smaller meetings of people. Reduce any unnecessary social interactions and promote, have your employees promote a healthy lifestyle with nutrition, exercising, and smoking cessation to help reduce the spread of the virus. So as of now, this is what we have. So the virus is seeing the lifespan of COVID-19 in air for about 3 hours, on copper for about 4 hours, cardboard 24 hours, stainless steel 2 to 3 days, and plastic 3 days. So this is some of the things that you think about and the type of things you have in your facility, and how long the virus can live, and you should really have in consideration of disinfection, which Sean is about to get right into. So at this time, I will turn it over to Sean.
All right, thank you, Brandon. I believe I have control of the slides. I'm going to move over one just to make sure, and it looks good. So my name is Sean Castillo. I am a colleague of Brandon over at the Shees Group. I'm an industrial hygienist. So we do a lot of work with workplace safety and health for small businesses across Georgia. I do want to mention before I get going, some of you may have noticed already in the chat, whenever I'm not presenting or Brandon's not presenting, we'll also be in the chat to listen to any questions and to answer in real time. We really like our classes to be interactive in all the webinars we do. So just if you have a question, put it in there and we'll answer it as soon as possible. And if we find things that are common themes or weren't addressed, we'll make sure to get to that at the end of the presentation, just so we get everything in order. So going into our disinfection, and we're going to talk a little more about PPE. CDC, your local health departments, and NIOSH, they put out a lot of really good information about disinfection and what to do and the steps on how to clean for COVID-19. So whenever you have visible soil or dirt, that's what you want to remove first with soap and water. And then we want to use something called an EPA registered disinfectant. We have a link of that and we can put it in the chat later, but EPA has given a link of chemicals and disinfectants that kill SARS-CoV. They also give you details about how long it has to sit on a surface, what kind of surfaces, what kind of chemical names, what kind of generic product names those have. So it goes into a pretty exhaustive list. And like this icon at the bottom says, for effective sanitization, wait the proper contact time. So this is really important because certain disinfectants take a certain amount of time to activate and kill whatever it's meant to kill. So you can't always just spray a disinfectant for 2 seconds and then wipe it up. Sometimes it has to sit for 5 minutes or more, and then you wipe it up and it's done its job correctly. So again, just these are little updates. I mentioned most of these, but always read the instructions from the manufacturer. This is also really important because you should never be mixing chemicals that you don't know can't be mixed. So most dish soaps, for example, will say don't mix with household bleach because you can create an off gas that is very harmful to whoever is using it. We also want to provide personal protective equipment, or PPE, as you hear in the news constantly, for employees who are performing disinfection and sanitization. So for some instances, when you're using like a Clorox wipe, you may want to use gloves, but usually those are pretty safe. However, if you have a janitorial staff now who's, ramping up their processes more than they would usually do, you want to make sure that they're protective, especially because they're getting such a larger dose of these chemicals than what they're, normally used to. You want to also provide training on the hazardous chemicals. So this goes into something called the Hazard Communication Standard. Some of you may be familiar with it, some of you may not. However, this is an OSHA mandated standard for anyone using hazardous chemicals at their facility, that they need to create a program where they keep something called an SDS sheet. So you have SDS sheets of all the hazardous chemicals you're using, and you also have a written program that talks about how you're going to train your employees about those hazardous chemicals, how you're going to train them to label containers so they know what's in them, how they can read pictograms on containers so they know what's also what kind of hazards those provide, such as if they're corrosive or some other kind of hazard. But that is a whole OSHA standard in its own, and it's one where you need a written program on. I will say, and we'll include these in the chat, that for some of the programs we'll talk about, we have sample templates on our website and for our group where you can go in and fill in your template to make it site specific and use that, so you don't have to reinvent the wheel, but we will post those. Also, other notes are to keep update with changes or recommendations published as we learn more about COVID-19. This is one that is, and thank you for Brandon for putting that link in. This is one that is very important, especially starting in March, which was, I know, when a lot of things got shut down and when we got sent to go work at home, but the information is constantly changing every day. We're learning more about the masks and their efficiency and efficacy, but we're also learning what kind of hazards are produced when we are cleaning and sanitizing. So just keep up with what CDC is saying, what NIOSH is putting out, and even OSHA is putting out information as well. Again, remember, concentration and set time are very important. The more you put, the hazardous it can be to your employees or yourself if you're using these disinfectants, and the set time. So if something requires 10 minutes of being set in contact time, it has to be there for 10 minutes until you wipe it up. And we have a link that goes into CDC about preparing and disinfecting buildings and facilities. But like I mentioned earlier in the chat, these slides will be provided. So this graphic and this information is taken directly from CDC about what to do in disinfecting your facility if someone is sick. And a lot of these are best case scenario. We can't always do it. But what they recommend first is if you have an employee who has been found sick at your facility, or someone who has tested positive with COVID-19, you first want to close off that area where the sick individual was working, and vacate other employees in that area to work in other aspects and other areas. You want to open outside doors and windows really just to get as much air flowing as possible and really get your just air circulating in your facility. In a perfect world, we want to wait 24 hours. However, CDC says wait as long as possible before you do your deep cleaning and disinfection of that area. Just it gives time naturally for the virus to die off. And we want to educate again. The main thing we want to stress as we talk about disinfection is we want to educate workers on how to disinfect properly so they actually kill off the virus, and how to protect themselves from those disinfectants as well and the virus while they're doing it. And clean and disinfect all the areas by the sick person. So when we think about disinfection, we really need to go around and think about what exactly we should be cleaning. And the first thing we want to look at is high-use area. So like Brandon mentioned, we prefer to have one employee at a workstation, but if you have people rotating, you want to make sure that that's disinfected pretty frequently. Other surfaces, so if you have doors that you know every single person in the facility uses, if you're not able to prop them open to prevent that contact in the first place, that's something that should be disinfected. If you're having a break room, know that, and you're allowing your employees to eat in that break room, know that you should be disinfecting those tables, those chairs, any microwaves or common areas that they're using, fridge handles, things like that. One thing we do recommend is that you allow employees to, eat outside or eat in their car, and that just gives them more space to spread out and reduce exposure. The main things we look at are reducing exposure in the first place before we put in precautions such as PPE. Other things we might want to think about when we're disinfecting high area uses that aren't in the break room or maybe in the break room are things such as electronic keypads or clock-ins, anything that tracks employees' attendance that day. If they're being used and being contacted with, then we want to make sure that we clean those up as well. Whenever you're cleaning electronics, you want to make sure that you follow the manufacturer's description on how exactly to clean those. However, a good rule of thumb is alcohol-based cleaners with 70% alcohol are usually good for electronics. So going in again to the steps on how to disinfect surfaces, we want to be wearing disposable gloves when cleaning and disinfecting. And then we mentioned this earlier, but again, you want to clean your hands immediately after gloves are removed. PPE in its entirety and also gloves are not infallible. They are privy to perforations and tears. Anyone who's worn any kind of latex glove or nitrile glove has probably ripped one at one point just doing regular activities. So it's also important to wash your hands. Just because you're wearing gloves doesn't mean that you're fully prevented from any kind of contamination. So you want to make sure that you train your employees really hard on that fact. Again, for disinfection, we want to use diluted household bleach solutions, alcohol solutions with at least 70% alcohol, and most common EPA-registered household disinfectant should be effective. One thing we want to talk about, again, with bleach is that it should be diluted daily. And so you can either do 3 tablespoons or a 1/3 cup of bleach per gallon of water, or 4 teaspoons bleach per quart of water. But this isn't something you really want to be sitting around under a sink because it loses its effectiveness. To get the highest efficiency and to really kill off anything you need to, that should be diluted and made daily. So if it's a janitorial staff, they should be reproducing that every single day. And again, don't just go and start mixing chemicals because you want the bubbles of dish soap with the bleach solution. You should, again, be looking at the safety data sheets of any disinfectants you're using, because those can, by trying to eliminate a hazard, by trying to be innovative, you can create another hazard for your employees altogether, which could be very dangerous. And also, it's important to know the kind of surface you're cleaning. So for soft porous surfaces, such as carpets, you want to remove physical contamination first and then clean with appropriate cleaners, because that's going to be different than cleaning a kitchen table. So here's, again, an example of an EPA-registered disinfectants list. You have their number, you have the type of ingredients that are in it, the product name, company, the contact time again, formulation type, and the date that they were added. So they give you a pretty exhaustive list of certain chemicals that can be used against SARS-CoV. So going into a little more about personal protective equipment, or PPE, this is where the OSHA regulations start coming into play. But OSHA provides up-to-date guidance on PPE, which also includes respiratory protection, which we're going to talk about pretty extensively. Using masks and respirators, depending on your task and your risk, like Brandon talked about, you have a hierarchy of risk. And it's important to review the standards on PPE. So OSHA has a specific standard for PPE in their Code of Federal Regulations, and that's CFR, or 29 CFR 1910-132. So if you're using PPE at your facility, it's important that you brush yourself up on the standard, because there are elements that are required for you as an employer, or if you're an employee, there are elements that your employer is required to give you. So in general, for PPE, the employer is required to do some kind of assessment at their facility to look at all the job tasks, look at the hazards of those job tasks, and then look at the kind of PPE that is required to perform their job effectively and safely. So you really want to base your PPE selection upon the hazard. The employer needs to make sure that it properly fits those employees. Sometimes PPE needs to be refitted periodically, such as respirators. So someone might lose a lot of weight throughout the year and they might need a smaller respirator than the larger one they were using before. It's important that PPE is worn properly and effectively, especially when the hazard is there, and that it's regularly maintained and replaced as needed. So if you see PPE starting to wear out, that it is on the employer's onus to replace that PPE. And that it's properly disposed of and removed for those that are disposable. So things like gloves, they're not meant to be used over and over again. So after that single use, you take them off, throw them away, wash your hands, and then when you need another pair, you get a fresh pair. So some of the employer responsibilities, again, with PPE is that they're provided at no cost to the employee. You have to access all work environments for potential hazards, must assess all work environments for potential hazards, again, in your initial assessment, and that needs to be documented for OSHA. And we have templates for that again, so if you want to learn more about that, you can contact myself or Brandon, and we can walk you through those steps. You also have to provide training for employees who use any PPE, so you can't just give them PPE and say, hey, use this. You have to show them where and tell them why. And you have to pay for replacement of any required PPE. There are some exceptions. I'm not really going to get into it, and there's some ways where you can, get some money so that an employee can go buy safety shoes on their own, but those are few and far between. So if you want to have a discussion on that, we can talk about that a little afterwards. So with PPE, especially in the COVID pandemic, there are a couple things we want to look at. One is to make sure that we have a proper stock and supply. This was really important at the start of the pandemic. It might be slowing down a little bit now, but it's still really important that we always have a constant knowledge of the need of PPE we have at our facility. We want to determine if there's shortages expected for needed PPE. So, for instance, if you're normally doing a process, and this is not COVID related, but if you're doing a process that requires respirators, or you've been using N95s because the total dust exposure or silica exposure or metals dust exposure at your facility is higher than the OSHA permissible exposure limits, and you are needing respirators, but you can't find N95 masks because they're out of supply, you still need to find some kind of substitute, or you have to work your job processes around to engineer out the hazard. You can't go to OSHA and just say, hey, we can't get a supply of N95, so now there's nothing we can do. Our employees are still going to do the same tasks because we have to work. That doesn't work in their eyes. You have to either get a different type of respirator or engineer out the hazard completely. Like I said, we work on engineering controls. Engineering controls are always going to be our #1 step in that hierarchy of controls. We don't ever want to just see something and say, I'm not going to try to even take out this hazard. I just want to give them respirators or PPE because it's easier or more cost efficient. In the long run, if you think about it, it sometimes might be extremely cost efficient to just engineer out the hazard entirely so that you don't have to keep buying this constant supply of PPE. And you don't have to be getting air monitoring done or noise monitoring done or things like that because you know that there's not an actual hazard. Like I said, there are substitutes to things like N95s, such as using a half-mask respirator. So when I'm talking about half-mask respirators, I'm talking about these elastomeric respirators, which are these tight-fitting ones. They usually have the black or gray plastic that goes on the front, and you have the cartridges on the side. And these are also great because the N95s and these disposable dust masks are, like I said, they're meant to be disposable. So you use them once, and when your shift is done or when your job task is done, you throw them in the trash. With these elastomeric respirators, you can use them multiple times, and you can take off the cartridges. Every part of it becomes removable. You can clean it with soap and water and store it in a plastic bag or a Ziploc bag or some kind of Tupperware so it can be clean. So those are some alternatives you can use if you're not able to find N95s or it's just becoming too costly by throwing those away because they are meant to be disposable. So again, Brandon showed you the hierarchy of controls earlier, but it's a pretty good method for any kind of risk. But this is a risk pyramid for COVID-19 in regards to respirators. So At the lower risks, you have face mask or respirator is not recommended. So these could be tasks such as if you have someone who works in the administration and they work in the office. So they're not actually going into the facility, they're not walking the floor, they don't really come into contact with any other individuals because they're just in their own office. That is something that's not recommended. As you go up higher, you get more risks. So medium risks, we might recommend face masks if they're coming into more contact with people. Higher risks, respirators recommended. So if you have someone who's doing temperature screenings outside, and right now the EEOC, and we're not going to get too much into the HR because that's not what we do, but the EEOC has said that it is legal to do temperature screenings of your employees as they come in during the pandemic, and you can also question them about symptoms. But if you have someone who's doing those temperature screenings, it may be beneficial for them and for you to put them in some kind of respirator because they're coming into contact with so many individuals. And if you have a facility like some of the ones we see where you have 200 plus employees working on a shift, that's just more time for contact and more exposure for that individual who's doing those screenings. Respirator also recommended and or required for higher level jobs, and this can be people working in healthcare who are, intubating individuals or working with sick patients who we know who have COVID and have positive cases. And we might even consider higher level of respirators such as PAPRs, which are your power air purified respirators. These are ones with basically battery packs, and they filter out air, but they provide cool and fresh air to the employee, and it blows out of their hood. These are also great in hot environments because wearing a respirator is not an easy thing to do. Even when we go out on consultations and I'm wearing an N95 for 10 minutes, that is a strain on my body and it gets hot and I get uncomfortable. So if you're wearing one the entire day, that is something that you might want to think about. Employees might be less productive, but it's also a hazard to them. So some of these higher level respirators, they offer more comfort so that they can work more efficiently and just more happily overall. So now just going into a little bit about respirators and face masks and what the difference is. So when we mention respirators in this presentation, we're talking about your N95s, those disposable dust masks. We're talking about the elastomeric ones with the 2 cartridges. We're talking about the powered air purifiers, the hoods. We're not talking about surgical masks or cloth face coverings. Respirators in themselves are designed to reduce workers' exposure to small airborne contaminants. So again, if you have dust exposures, if you have lead exposures, or just COVID in general, respirators are designed to filter out those particulates on the face piece or in the cartridges so that it never reaches your breathing zone. Again, these are not infallible, so we do want to do engineer control such as increased ventilation or other processes before we ever get to this. In terms of respirators, we have both disposable and reusable respirators which are available. And so, like I said earlier, the half mask elastomeric respirators are completely reusable. You take the cartridge out, you put the respirator in a Ziploc bag or some kind of container and you store it. One thing I do want to stress, and we've seen this a lot throughout consultation, is that those are properly stored. So we've gone out to facilities where we're doing an audit and we walk the floor and we see a nail on the production line and production floor. We see a nail on the wall and someone's hanging their respirators by the straps out in the open air. There are a couple issues with this. First of all, if you're leaving your respirator out, it has a chance and opportunity for the inside of your face piece to be contaminated because it's not sealed off. So if you're working, and again, these are not just COVID, but if you're working in a paint booth or something along that line, and you have multiple employees who are doing work and you hang up your respirator, while that other employee is doing work, it has the opportunity for that paint, things such as isocyanates and other really harmful chemicals to get in that respirator. Another thing is that if you were hanging your respirator by the straps, just on a nail, gravity does wonders, but it also pulls down and it starts to wear on those straps of your respirator. and that just decreases the integrity of your actual respirator. You might not get as good of a seal, and then your employees aren't protected at the same rate that we really want them to be protected. Another thing about respirators in this country, they are NIOSH certified. So if we didn't say it earlier, NIOSH is the research arm of OSHA. So OSHA is where we do enforcement and things like that. NIOSH is the science behind all the standards, but they certify the respirators that are used in this country, and they're housed within the Centers of Disease Control and Prevention. It's important to look to see when you're buying a respirator to make sure that it's authentic and it's been NIOSH certified. And in a couple slides, I'm going to talk to you about some of those markers to know if they're good or not. And NIOSH has some really good websites and resources that we can link where they show how to look at a counterfeit respirator and find out if it isn't. So now going into face masks, which you see everywhere. Hopefully you see them in most stores and Kroger's and most facilities now. And these are worn by workers as a physical barrier to protect against splashes or large droplets of blood or bodily fluid. So they do offer some level of protection on these larger particles. However, smaller particles can still get into these masks. They're worn by healthcare workers to prevent contamination of patients' wounds. They are placed on ill persons to limit the spread of disease, and they're FDA cleared. So hopefully this discourse has happened throughout the news and everywhere, but the main reason that face masks are being worn are so that you protect other individuals from yourself. And that's really why they're not considered PPE, because they're not protecting you per se, but they're limiting the spread of your potential infection and the virus, if you were to have it, from reaching other people by stopping it from ever leaving your body. So the whole idea is if that everyone is wearing these face masks at your facility or just in the general public, you're stopping the spread from each other from reaching each other. So you're not protecting yourself per se, but you're limiting what you spread to others so that you're not getting someone else sick. And the idea is if everyone does that, then we'll have less infections overall. But these surgical masks, and these are usually the blue ones with the ear straps, these are FDA cleared. So there's a whole process if you're some kind of manufacturer for these to get those cleared for sale in the United States. And that's through the FDA, not through NIOSH like respirators. And one other thing I do want to mention before I move on, and this might be included later, it might not, but with certain respirators, some of our respirators will have something called the exhalation valve, and that's really used so that employees can be more comfortable when they're using their respirator, and so they can breathe out more efficiently. However, if you're using an exhalation valve, you're allowing what you're breathing out to reach another individual or employee. So that is something to think about when you're looking at the masks and the respirators that you buy. In this time, we really want to be limiting what is expired and exhaled. So cloth face coverings, excuse me. These are the ones we see everywhere we go. Again, they are not considered personal protective equipment because in a sense, they're not really protecting you from these small harmful particles that we're really trying to avoid the spread of right now during this pandemic. They can be commercially produced or homemade. You know, you've probably seen a lot of neighbors or family members selling these on Facebook or just reaching out by using old t-shirts and things like that, which has been good because it's stimulated another sort of business, or other facilities can rework what they usually do to create these masks. So it's just another example of how we're innovating during this time of pandemic. But people will use scarves, garments, bandanas, or other fabrics. They should be worn over the nose and mouth. And so this is something you've probably seen a lot as you've gone to Kroger. You may be guilty of it, but it's just important to know that you should be wearing those face coverings over your nose and mouth, and that's because there is exhalation from both your nose and mouth, since you can breathe through both. That helps limit the spread of the virus when someone coughs, sneezes, or talks. And just you want to limit the contamination from every part of your body. So these are not a substitute as PPE for respirators, such as respirators. Again, if you have an employee who is in contact with infected individuals and you know it, such as working in healthcare, or if they just have a really high exposure or they're doing certain tasks where they can be exposed, or if they're doing tasks not related to COVID, such as ones that release large amounts of dust, silica, metals dust, things like that, you have to continue to give them the appropriate respiratory protection because face masks aren't going to do it. It's also important to know that you really need to look at the processes at your facility and see if wearing face masks is even something that you could do. So if I'm in a paint booth, and I've used paint booths for examples for a couple of these, but if I'm in a paint booth and I'm wearing a cloth face mask and I'm getting wet and everything's getting wet around me, a cloth face mask, even if you're not fully exposed over any permissible exposure limits, a cloth face mask could prevent a hazard in itself because you could be having some kind of chemical that sticks to that mask and really gets inside the mask, and then you have a higher concentration in that employee's breathing zone of another chemical. So by trying to reduce the hazard of your employees in general, you're creating another hazard. So it's really important to be conscious of those tasks and where you're telling employees to wear these masks. So the cloth face coverings, they can be disposable or reusable after proper washing. You want to make sure that you wash those in the warmest water setting. Those can be washed with regular detergent, regular bleach in your washing machine. It's also important to look at those who might have trouble wearing these masks. So the EEOC, again, and it's important to look up what they're saying, but as of their last update, employers are able to mandate the use of these cloth face masks. So you can tell your employees that they have to mandatorily wear them. It's important, though, however, that some might have some kind of disability or non-ability to wear these masks because they might have asthma and it might be really difficult for them. Or they might have, and it's important to look at other things. So someone might be hard of hearing or might be deaf, and one thing they might do is to read lips. And so they might have to have some kind of other reasonable accommodation. So those are things to look for as an employer. So again, here's an example of a surgical mask or a face mask. You can see it has the little straps on the back. The cloth face coverings usually are just in the front. They'll have the ear loops. And again, respirators, we've been stressing this a lot, but respirators are really used to reduce an employee's exposure to airborne contaminants. They're designed to provide a tight seal between the respirator's edge and the wearer's face. So one thing I want to get into in this, and it's an issue in a lot of facilities we go out to, a lot of manufacturing facilities, is that if you were mandatorily making employees wear respirators, they cannot have facial hair. So even myself, I don't have much facial hair right now, and I don't have a beard that I've been growing. Some of your employees might have been growing quarantine beards since March. If they have facial hair that gets in the way of where the seal is supposed to be, then they don't have a tight seal and you are out of compliance with the elements of the respirator standard, but also your employees are at a higher risk. Our human hair is larger than some of the particles that we're protecting against with respirators. So if anything is blocking that seal, they can get it. Some of you may have seen on the news, and this made the rounds, and it was pretty funny because we use this image a lot. It's not included here, but the CDC released this big picture graphic where they had a bunch of different facial hairstyles. And people were thinking that the CDC was giving out this information to say that having a certain beard makes you more susceptible to coronavirus, and that's not the case. What CDC was saying and what these graphics were saying is that different types of beards and hairstyles will get in the way of your seal. So if you just have a mustache or just have a little soul patch or even a goatee, but your seal is still able to go along your face and seal tight and properly, you can wear those. However, if you have a full beard coming down and you put that respirator on and it squishes that beard, then you don't have the proper seal. And those are things that you'll find out when you do things such as fit testing, which I'm going to talk about in a second. So respirators have to be used in context of the Comprehensive Respiratory Protection Program. And so again, OSHA has a specific standard for respirators. It's 1910 for general industry, 134 for respirators. And I'm going to go into some of the the elements of it, but one of the main things is you have to have a written respiratory protection program. Again, at our website, oshainfo.gatech.edu, which Brandon posted earlier, we have those resources and we have those templates for you to fill out. The main thing that we do ask is that you do make it site-specific. I've worked with facilities in the past who needed respiratory protection. They downloaded our template, but they never filled it out. So it basically says, facility has a respirator program, person is in charge of training, in charge of getting the respirators, these people have to wear it, these are the type of respirators, but nothing was filled out. So for all intents and purposes, for OSHA, they do not have a respiratory protection program. So filtering face piece respirators, again, I talked about, these are the ones such as the N95s where the entire face piece is comprised of filter material. So if you're wearing an N95 mask, you put it on your face, the whole area is a filter, and you breathe in, and as you breathe in, the particulates get filtered on the outside. There are different classes of N95s that you may hear. So you may hear of N's, R's, and P series. So this is basically saying N is not oil resistant, and they're talking about the resistance to oil. R is somewhat oil resistant. P means oil proof, so that's the highest level of resistance to oil. There's also different ones such as N95s, N99s, N100s, R95s, R99s, and so on. And this is basically just a higher efficiency level. So if you're a facility who's been using N95s in the past and that's all you've been using and now you have a less supply, that is something you can look at for looking at an R series or P series and seeing if they have those supplies available, because they'll do the same job, just have a different resistance to oil, and they might be more effective anyways. But N95s are the most common, and it's the ones you hear most about in the media and the news and everywhere else. And I mentioned this earlier, but again, some respirators have exhalation valves, and it helps with breathing resistance and moisture buildup. That's something to look at if you're trying to protect others from that user as well. So if I'm sick and I'm wearing an N95 with an exhalation valve, I'm just spreading those particulates out to everyone else. This is an example again of an N95. You can see it says N95, it says the manufacturer, it has warnings, and it should say NIOSH as well. Again, here's another N95 with some labeling. So you have the manufacturer's name, the name of the device, the filter efficiency in the class, and you should always have this certified by NIOSH. So a couple things, again, after this, I'll link the NIOSH website where they talk about counterfeit respirators, but it should always say NIOSH. So there's some examples, and they're actually pretty funny, where it'll say NOISH, and it'll say like N-O-I-S-H. And that's not NIOSH writing it incorrectly, that's someone else making some kind of counterfeit respirator. You should also know that respirators are not certified, NIOSH does not certify respirators for children. So if you see something that says respirator for children NIOSH certified, that's kind of a red flag. One other thing about these respirators with filtering face pieces is that, like some of the cloth face masks, you have the ear loops. That won't happen on a NIOSH respirator. You'll have the two straps that go around your head and the back. So that's another thing to look out for. Other considerations, again, if you can't find N95s, but you need some particulate respirator, make sure that you can do something using elastic mirror respirator. You want to make sure that you have the right cartridge though. So making sure you use particulate cartridges and not something like an organic vapor cartridge, because then you won't be filtering out anything. Also, if you're going to use a particulate cartridge for another process, so if they're not just one size fits all, you can't just take it to a paint booth and use a particulate cartridge because you won't be protecting against the same things. Some respirators have combo cartridges, so you can have combo organic vapor and particulates or other combinations to reduce costs and just reduce the amount of cartridges you need. And then we also, again, have those PAPRs I mentioned earlier, and these are reused respirators. You can wear them for longer times, and they're more comfortable, and these are really good for hot conditions. So for the high exposure risks, again, we want to be using respirators that have higher protection factors. I'm not going to get into the math, but protection factor is just showing how high of an exposure the employee can stand in a certain type of respirator. The filtering face piece or N95s, those are about 10. So they're the lowest protection factor. As you get to half mask elastomeric, you have higher. If you get to full face elastomeric, which have the face shield, you get even higher. And then once you get to these powered air purifying respirators, you have some of the highest protection factors. So if you're doing laboratory procedures that involve handling viral cultures or aerosol generating procedures, these are things that you'll definitely want to look into. Excuse me. So with the respiratory protection program, like I said, if you have mandatory use of respirators at your facility, you need to have a written program that goes into the following elements. And these are all taken directly from the OSHA standard in the Code of Federal Regulations. So for instance, some of the things you need to document are the selection of respirators. So you have some kind of exposure monitoring already, or you have an employee at high risk and you have written down what kind of respirator they'll be using. So you'll, for instance, you'll say N95's respirator used for this test. The next thing you have to do is have a medical evaluation of your workers. So this is essentially a questionnaire that the employees fill out and they send to a physician. And the physician writes off if they're able to wear a respirator or if they need a different type of respirator. So some employees might not be able to wear the tight-fitting masks, and the physician might say they can only wear powered air purifiers where they're not having to breathe and strain themselves. These are things that you don't have to go and get a physical test from. They're just a questionnaire included in the standard. However, some companies such as 3M, and that's just one of the ones I know of, offer online questionnaires where your employee signs in, they fill out the form online, send it to the physician, and they get a written approval. It's important to know that if you have an employee who you have some kind of exposure monitor, wear a respirator for that task. So if there's too much metal dust or things like that, and they cannot medically wear that respirator, you have to either give them one that they can wear, or you have to put them in some kind of other task. You can't just say, well, they have to wear this N95. I don't care if they've been evaluated or not, or the evaluation came up bad. You have to find something that works for them. The program also talks about proper use by the workers. So making sure that they store it properly, make sure that it's cared properly. The other thing that has to be done is that if employees wear those respirators, they need to be trained adequately on the respiratory protection. So why they need it, how to properly use it. So there are some things such as if you're using the ones with cartridges or even the N95s, there's something called a user seal check. And when you put on that respirator, you check to see if you can breathe in and if anything moves, and when you breathe out to see if you still have that seal. But that's something they need to be trained on. That comes directly from the standard. And also you want to do regular program evaluation every year to make sure that your program is audited if there's any deficiencies. And record keeping. So having any kind of training documents on file. So if you've done a respirator training, make sure that you have some kind of employee sign-in sheet, things like that. Because if OSHA comes out to your facility and they don't see any of those documents and employees don't remember the training, for all intents and purposes, you did not do training. So those are some of the things that come out with that standard. And again, if you need help developing these respiratory protection programs, or you feel overwhelmed in making your own, please reach out to myself or Brandon, and we'll be more than happy to assist you in walking through those steps, doing the video call, or just reviewing your programs. We're here for your assistance. Again, we're looking at strategies for each exposure risk. So we have high exposure risks. Those ones who have to wear respirators, again, need fit testing. And actually, I apologize, I didn't even go through fit testing. What fit testing is when you're wearing a respirator, it's using some kind of smoke agent or chemical agent, and you're testing the seal and you're spraying around an employee to see if anything is leaking in their respirator. And so, for instance, some respirators use something called irritant smoke, and you spray the smoke around the employee's breathing zone, around the respirator, and if they cough, then that means that there's a kind of leak. This is one that's pretty hard to hide too. It is important to know that with some of the fit testing, some people might not have any kind of reaction. So you want to test before you do the fit testing and see if there's a reaction. Because if not, then you have to do some other kind of fit testing. But that is required for anyone who's using respirators. If someone is switching sizes of respirators, again, if you lost weight and you were originally a large respirator, but now you're using a medium, you have to get it tested. If you used to use one brand of respirator, but now you're switching to another, you have to do that fit testing as well. So I apologize for not bringing that up. But with your exposure risk, the high exposures, if you're wearing those respirators, again, fit testing, medical evaluations, making sure they have respirators, provide training, and then as you get on the lower risks, you may or may not even need respirators, or they may not be recommended. But again, this is you assessing your facility and the risk at your facility. Again, employee training, it's a specific part of the standard. We want to make sure that this training is understood by the employees, so that means it's in a language that they can understand and at a literacy level that they can understand. Here in Georgia, we go out to facilities all the time of manufacturing who some employees may not speak English, they may only speak Spanish. We've gone out to poultry facilities where they can speak up to 20 different languages or dialects at the time, so it's important to have some kind of comprehension for them so that they're getting the proper training, so that they're protected the best that they can. And again, you need to document this training, because if it's not documented in OSHA's eyes, that means you didn't do it. So OSHA enforcement, during the OSHA's been putting out a lot of guidance, and we encourage you to go to their website that's listed below to see what they're putting out, because this is changing. But OSHA is putting out enforcement discretion and guidance on things such as annual fit testing for N95. So if you're a facility and you usually have some kind of contractor come out or some consultant who comes out and does your annual fit testing, or you can't get the supplies, OSHA will give some discretion on giving citations for those kind of things. However, they are saying that if you're putting an employee in a respirator who has never worn one before, you still have to get them fit tested. That's just a non-negotiable. But they will give you leeway in the annual fit testing. They're also putting out some guidance about things such as using foreign respirators. So here in America, like I said, we have those certified by NIOSH. In other countries, they may have respirators that are certified by other agencies and other standards. OSHA has a list of some of those standards that you could use if there is a supply shortage. And the important thing is that you have documented that you cannot get these respirators. So you can't just say, this one company I looked at didn't have N95s, now I'm going to go get another one certified by some other country. No, you have to show that you did your due diligence and you really exhausted all options. Also, part of exhausting all options is looking at other kinds of respirators besides N95s. So again, using those elastomeric ones with the cartridges instead of N95s, and that may also be more cost effective for you anyways. They also give some enforcement guidance about using respirators past their use date. So some respirators have expirations. They may look good, and OSHA has given some guidance on saying when to use these. Again, if you've exhausted all options, how to inspect them for any tears or perforations, making sure that there's no holes or punctures in the face pieces, making sure that the straps aren't stretched out too much, they're still tight. But OSHA goes into some of that in more detail in some of these letters at this link. They also talk about ones that are using them more than once. So like I said earlier, N95s were supposed to be used only one time. OSHA has come out and said that if you've exhausted all options, you can use them more than once, although it's not recommended. But here are the steps to make sure that when you're taking off and putting back on, that you're making sure your employees are safe, because it might be contaminated on the end. Again, these are all things, and we had only applies to health industry. As time has gone on, OSHA has really given more leeway to just all industries, so it's important to look at these, because there have been some amendments that say now this does apply to general industry. But the main thing, again, is that OSHA is saying you've exhausted all your options before you look at these. And it's also, again, if you have a process, not COVID related, that requires respiratory protection, and you need to protect yourself from some kind of dust or metals dust, you still need respirators. You can't just say, I can't find them. You either need to find them, or you need to put in some kind of control where you don't even have that hazard. And going forth, and some of the other things are eye and face protection. And again, if you have questions about respirators, please let us know. Respirators are really something that require a lot of nuance and discussion. And so, I mean, we dedicate full-on 4-day classes just for respirators at Georgia Tech. We have some more free seminars where we just talk about respirators. So please feel free to email myself or Brandon or anyone at our team if you're using respirators or have questions about the respirator use at your facility. or have some questions about the supplies, we have some contacts we might be able to get you in touch with to make sure that you get those ordered and properly used. But going forth with eye protection, again, you have to determine where it's needed. Not really recommended for medium exposure risk category, and you want to ensure that employees who need it use it. Eye protection is one of the easiest ones for employees to take off, and usually it's because they either get foggy or they're just uncomfortable. So you want to make sure that you're enforcing that. Also, if employees are wearing prescription lenses, some eye protection can be modified to have those lenses, but also some eye protection can go over. And sometimes when you have larger glasses like me, you might have issues with smaller ones, but they do make eye protection that fits over and protects you on the side and in the front, which is what we're looking for on full coverage all the way around. And again, challenges with our eye protection, we want to know, does everyone wear it every time? Again, this is where we see the least amount of compliance with employees taking them off. Do they fit properly? And are they in good condition? And how do we encourage their use? That's something for you, your facility. You might want to incentivize good behavior. So if you see people wearing their glasses properly, you know, we always encourage some kind of incentive system where if you're wearing your PPE, you're in the line for a raffle or something like that. But that's really up to you to decide. So with that, I am going to send this back over to Brandon so he can give you the rest. So thank you very much for your time.
Thank you, Sean. We're going to finish up by talking about some planning focus areas and strategies that you should be thinking about as we continue on. So we want to think about some essential functions of your business operations. So the financial aspects, supply chain, possibly security. We want to think about things human resources will have to combat during this time. The communication aspect, the information technology, and we're also going to talk about the community connections and government agency support that is needed for your business during these times. So strategies in financial and operations. We want to think about the electronic access of all financial management processes. Like if people are working from home, are they able to access all the files they need to access? Any cash that you have on site, you want to make sure that it's secure. Operations, who will manage operations? Who is the backup in case someone is out? Who is in charge? You want to make sure that everybody knows that it's a written out plan that if somebody's out, this person is taking over. We also want to talk about you want to have operations work closely with HR on the stuff that staff and volunteers need. And as I said earlier, you want to cross-train your employees so that if a person is out, someone else can be able to take over their job in case something, and make sure that production continues. So during these times, you also, for your materials and supplies, you want to identify what kind of supplies that you need. As Sean was talking about with respirators, maybe now with respirators and PPE, maybe now that it's calming down since the start of the pandemic. But you want to know that whatever items you have, can they be safely stockpiled? Like, are there expiration dates? Like, could this be in my facility stored for a long time and still be able to be used in months after months? Who is going to be in charge of managing that? These are questions that you need to ask yourself as you're building out your plan. I'd say you want to consider the shelf life of these of items, and you want to make sure that you're able to store them and have the ability to, and also while not creating a different type of hazard for your employees. So you don't want to be stacking boxes of materials up in your office or your warehouse that can create additional hazards for your employees. You also want to think about maybe working with maybe working with a local business partner to help them and they help you with whatever tasks you have going on. And then as I said earlier, also you want to plan on how to have your employees who are making deliveries, how they're going to do that safely. And you will also need to look at the closely at the supplies that you will use and you will need during this time. So as different types of PPE and things of that nature, to make sure that you have enough to cover all of your employees. So I guess everybody has seen that during this time, the pandemic has created stress for a lot of people, and people are acting out of character. So some businesses have to have security in order to help keep everyone safe. So you want to think about, does your business need security, or do you think your customers will become combative with your policies that you have? So security can be there to help enforce the use of whatever measures that you're taking for your business, so your employees don't have to be confrontational with the patrons who visit your facilities. You want to secure supplies and material, and you want to provide training with your security personnel, making sure that they have the correct and proper PPE that they need to carry out their tasks. And you want to also coordinate with your local and state agencies just to make sure that you're on the right page, because different areas have different needs for this pandemic. Some areas are a lot more critical than others, and some things can be a little more relaxed in some places, and some things need to be a little more stringent. So you want to make sure that you know exactly what's going on in your area. So it's always key to be in contact with all your local health officials. And as far as human resources, you want to participate in assessing employees' risk exposure, as we spoke earlier. You want to see, where do your employees fall? Like I said, that sometimes in the facility, some employees may have a higher risk than other employees. So you want to know that they understand that in this area, this is required versus being in this area. Revising the leave policy to make sure that people know that if they are sick, they can stay home without possibly losing their job. You also want to communicate necessary precautions to your employees. And with that, you want to make sure that it's coming from one person or one source or one avenue, that is not necessarily word of mouth, because after a while, we know that the story slightly changes. So if you have one direct avenue of how you're communicating with your employees, everybody will get the same information at the same time, and it will not change. And that's why communication is so important. And then you also want to try your best to monitor that your employees are actually following and adhering to all the policies and procedures that you're putting in place for their safety. And human resources also should be thinking about how you're going to deal with staff shortages. Who can fill in for whatever position is lacking at that time? The qualifications and trainings that person needs. So let's say if someone who is a forklift operator, he's the only one in the facility. No one else is legally able to drive that forklift unless they go through training. So you want to make sure that you have multiple people trained in case someone is out. Now you see that a lot of parents are having to deal with this issue with schools being closed and childcare. So you want to make sure that parents can try to give their children what they need without having to risk losing their job. And if you ask employees to work long hours and more days, what are you giving them to give them an incentive to work? Like more rest areas, give them some type of food just to keep their morale up, to help the business keep functioning. Most importantly, communication. You want to be clear and honest with your employees of what's going on. And then also with your customers and suppliers. And communities, also with the community leaders, to let them know exactly what is actually going on in your facility and who is responsible for what task. So communication is key, so no one is ever left in the dark of guessing of what is actually going on in the facility at any given time. And the communication could be done frequently. It should be done frequently, I should say, and you should try to use a different variety of tools of communication, where if it's a text message or email, it depends on what your workforce needs. And because some people do not have access to everything that others have. Some people can't get emails outside of work. So you want to make sure that those people have a way to get the information, making sure that the information is the same. You could try the 5 times approach, where you communicate each message 5 times in 5 different ways, maybe on 5 different platforms. And then you want to be very open with your employees. Be open, and so they can ask questions of what's going on, so you're not seem like you're hiding anything, that you're showing them that you're doing everything that you possibly can to protect them while they're in your facilities. So when we talk about creating a plan, like we said, communication, clear is kind. So if you're very clear, everybody will believe in the message that you're giving. So there are several steps that of creating an actual continuity plan. So you want to designate a communications coordinator. And the communications coordinator will be responsible for making sure the policies you are adapting are legal and accurate and appropriate for your business. And you want to also designate a spokesperson. So let's say that this person will be available to speak to whoever wants to have an interview with the business in case like you have like outbreak. This person will be the person in charge of delivering whoever approaches the business and speaking with them. You want to identify communications needs, where you're going to identify your target audience and the goals of what your audience is. So your audience could be your employees or your customers, and you want to see what the goals are for each one of those. You want to determine a key message and determine the type of message per audience. You want to identify the materials that are needed to get the communication out. And you want to create a communications plan. So that's involved with determining information dissemination channels. As I said earlier, maybe it's different avenues, text message, email, or posting on your bulletin board at work. You want to identify media and communications resources. You want to also prepare the first announcement of what is actually going on in your facility. And you want to update procedures as things are changing, because we know from March to now, the knowledge of this virus has changed, and the recommendations have changed based on the new discoveries of science, and that's the way science works. When we find out new things in science, we update and adjust the recommendations that we had, because we thought one thing that we thought is proven that something else is more effective. So you just want to make sure educate your employees that everything what is being done is only being done to help protect them. And then you want to monitor information flow and public responses. It's really key, as I said, that you want to make sure that the same message is being delivered to everybody without there being any type of miscommunication. So with information technology, we want to plan in advance for easy connectivity and compatibility with emergency services and law enforcement and public health services. So you want to make sure that you are able to get be aware of who those people are and ways to contact them whenever you need them during this time. And then during this time, everybody is really using the health department and the resources from the health department. So you want to make sure that you know how to access them when you need them, and you want to also know how to access of contacting any type of family members of employees that you need to. And just plan to continue to use your information technology avenues that are out there. Employee education. So you want to educate your employees on what's going on. You want to talk about the different hazards they may occur while they're in your facility. And you want to give them strict facts of what's going on in your facility and what are you doing to reduce exposures and the use of PPE. And then also with all of Sean was talking about, when Sean was saying about, especially regarding respirators, you want to make sure that they are properly trained on how to use the respirators, as Sean said, because if OSHA were to show up to your facility and training is not done, then that will be a negative effect on the company because they didn't properly train. So, and then you want to let employees know what is your plan for COVID-19 in your facility, and what are their roles and of anything that they need to do to help combat the virus. So you want to especially train them on housekeeping. That Sean was saying with disinfecting multiple surfaces and being sure that with the disinfecting that they understand about contact time and making sure that the product stays on the surface long enough to actually kill the virus. And they need to know where to access any cleaning supplies that they need without any problem or having to go look for them. Just want to make sure that they are aware of everything that's going on in your facilities at all times. So I'm going to start off this slide by saying that the pneumonia vaccine will not prevent you from getting COVID, but it is suggested that people over 50 do get or with chronic health conditions get the pneumonia vaccine because it can help relieve, it can help protect against other respiratory illnesses, not necessarily COVID-19. So it will not prevent you from getting COVID, but it could possibly reduce the severity of you having COVID-19 with developing other respiratory illnesses. And as you know, they're working on trying to get a vaccine for this virus, but it's not available yet. So what do we do in the meantime? We want to wear our face coverings and things in public to try to help reduce it. And face coverings do not prevent you from getting the virus, but it can help reduce the chances. And then you want to also really adhere to proper hand hygiene, just continuously encouraging your employees to wash their hands throughout the day and try to help keep surfaces disinfected. And also with proper etiquette of sneezing and coughing, as we discussed earlier. So how to help reduce non-occupational exposures, you want to look at locations and processes in communities where people come together. So your stores and your churches and everything of that nature, buses, trains, and planes. And you want to look at trying to encourage your employees to stay away from those areas, because by them going to those areas, they could possibly contract the virus and possibly bring it back to your facility. So you want to try to help reduce exposures by awareness of good hygiene practices, avoid high traffic times at those locations, So you want to try to encourage those web-based groups and discussions and conference calls and stuff like that, just to try to mitigate the need to congregate with a lot of people at one time. And to achieve that, education is the biggest thing, and trying to get them the correct information and the scientific information that is out there. Try not to impose fear mongering on people, and try to just provide direct scientific evidence as we know of today, of where science is today. Because people get information from so many different avenues that some avenues skew the information to make it seem something that it's not. So you want to make sure that you want to try to follow strict scientific evidence of where it is today. Additional strategies, as we talked about, avoid close contact, social distancing, discourage sharing workstations and phones and all of that nature, reduce unnecessary social interactions. As we spoke of earlier, we want to try to reduce the fact that the safety meetings in the morning have less people. Just try to reduce the number of people in the area at any given time, and encourage a healthy lifestyle. If you already have a plan, you want to continue to review it, and you want to update it and discuss it with community leaders to make sure that you're on the same plan that they're on. Be a part of updating the plan. Involve your employees. You want to support the education of the community and have strict facts as you move towards developing your plans. Your plan should be regularly reviewed and updated, and you should, like I said, you have input of the community agencies, but you know sometimes those agencies are hampered, so you just want to make sure that you try to contact them early and see what their plans are and how it can be a benefit to your plan. And then if you have transportation needs, that you understand the risk and everything of having your employees in different avenues, such as delivering packages and everything. You want to make sure that they have the necessary tools that they need to help reduce the spread. And then as far as family plan, you want to make sure that your employees know that that what they can do if the schools were closed, have them think about a strategy that they can develop if schools were closed. If their parents are ill, what structures that they have to support and help them. And this last part is difficult in some areas because there's a lack of internet in some areas, but continue to use avenues of the internet to help support people in need. And then if families have questions, keep updating and changing of the information of what's going on in their facilities. You want to be proactive more than anything. You don't want to wait till something actually happens. You want to be proactive and make sure that in the beginning you have everything set in stone, and nothing. You'd rather have nothing happen at all than to wait too late and then you have to deal with a whole big issue. So the whole purpose of developing a plan is to help protect the employees. First of all, you want to protect your employees. And then by protecting your employees, your business will continue to operate, and it will also protect their families and the community. So as far as OSHA guidance, OSHA has, if you visit OSHA's website, they have plenty of resources that you can use and read through related to COVID-19. And as far as OSHA enforcement, OSHA has the ability to enforce what they call the general duty clause, which they can, if they've shown that there's a known health hazard or hazard in general, and you did nothing to protect your workers, and your workers got sick or whatever, OSHA can cite you for that, even though they don't have a direct standard relating to COVID-19. But I will say, if you live in the state of Virginia, Virginia's OSHA has just come out with a policy, COVID-19 policy within the last couple of weeks that they're enforcing that's directly related to anything that they will enforce that's directly dealing with COVID-19. So if you visit Virginia OSHA's page, you can get more information regarding that. And then just more information on OSHA enforcement and everything. So if you, as Sean said, if you have any questions or you need help, please email him or myself. If you live in the state of Georgia, you can visit anybody can visit our website, but if you live in the state of Georgia and you want more assistance, you can fill out our OSHA request form, and then someone from our team will be contacting you on things that, whether we have a web-based conference call, that's what we'll start off with, and then possibly going on site. But this type of, the OSHA consultation program is in every state. So whichever state, if you visit OSHA's website, you can find a consultation program that will fit the needs of what you have. And one thing that Sean mentioned earlier, he's mentioned that we have a respiratory protection class, along with a lot of other classes related to professional education that we're now giving online. So you don't have to necessarily come to Atlanta to get the classes. So if you visit the Georgia Tech Professional Education website, you can get a list of all the classes that we offer. And then I will turn it back over to Donna.
Okay, thank you so much. Wow, a lot of information. I tell you, this is really, really good. We probably have time for a couple of questions. Brandy, were most of the questions answered in the chat box before we close?
Yeah, I love having two speakers because these two worked together beautifully and they answered all of the questions that came through the chat.
Okay, so we're good on questions. So as we wrap up, let me make sure I have the slides here. I do. As we wrapped up, I just wanted to say, times continue to change as we learn more and more about COVID-19. So as Brandon and Sean mentioned, do stay connected to the OSHA department in your particular state. I do know we probably have some people who are not in Georgia, but if you are in Georgia, you can go to the site here on that they gave earlier and learn more about it. It's really important that you stay connected to the information because it does change, and it is changing as we learn more and more about the COVID-19. So thank you so much, Sean and Brandon. This has really, really been very helpful, very technical, lot of good information for companies that are on the line. As we wrap up, I just wanted to mention that we do have some upcoming training opportunities and capacity building. Our National MBE Manufacturers Summit 2020 is now in its 5th year on November 16th and 17th, and I'll talk a little bit about that later. The MBDA business centers through MBDA were given additional funding through the CARES Act to bring programming and information such as you heard about today. And to that end, we have, again, some programming that is upcoming that we'll share with you very shortly. You can visit us at nationalmbemanufacturers.org. That is our manufacturers website. And you can also learn about the summit at mbemanufacturerssummit.com. You can reach out to me or Scott Capital Ventures, Jennifer Pasley, if you want more information. Here is the information about our summit. We are really excited this year because we are moving to a 3D virtual platform where companies attending this year will actually enter a virtual reality, if you will, experience for the summit. So it will continue to bring networking opportunities, B2B one-on-one meetings with corporations. Our innovation pod showcase will continue with our poster walk. For any of you minority-owned companies that are on the phone, on the webinar or attending here today who'd like to participate, and we will be having some virtual manufacturing technology tours, so stay tuned for that as well. As I mentioned, the CARES Act Assistance Program was provided, has been brought to you by the Minority Business Development Agency in the CARES Act. This program provides us technical and training and assistance, as you see today, in health and safety, but also we're going to be launching cybersecurity training and consultations as well. Compliance to the Paycheck Protection Program, or PPP. I think the second round of PPP just ended August the 8th, and from what I understand, there will be a third round. But right now we have closed out the second round, and we're focused on helping our companies comply to PPP so that you will be able to get that loan forgiven. We also are identifying funding opportunities. For example, if you're living in the city of Atlanta, Invest Atlanta has launched this Resurgence Grant Fund. It launched on August the 10th, yesterday, and applications are now open for the Atlantic Resurgent Grant Fund. Will close on August the 31st, so it's important that you get your application in if you're a company that's located in Atlanta, and we're doing some pivot strategy work that we'll talk about. I'll mention our roundtables shortly. Our program will be conducting listening sessions, roundtables, surveys, and that kind of thing, because we want to know what you need during this time and how our center and how MBDA can help you. Here are our upcoming webinars. We are having a roundtable discussion with the group that you have here today, our SHE's group. It's really focused more on construction. Our construction clients and companies, you're welcome. Everybody's welcome, but they will be having a more intimate introduction to our OSHA and our SHE's group, as well as being able to have a roundtable to get your specific questions answered about what's going on in your facility. On September 23rd, we're going to have Introduction to OSHA for Small Businesses. So for those of you who are on the line who want to learn more about OSHA for small businesses, you will be getting that information, as well as we're going to be doing machine guarding on November 4th. We are launching our cybersecurity dual pandemic. Is your company protected? So stay tuned for the date on that. And finally, our Pivot to Thrive Roundtables is also a CARES Assistance Act program that we launched 4 weeks ago. This is where we bring 6 to 10 companies together for 4 weeks, 2 hours at a time, usually from 12 to 2, to really have peer support during this pandemic. We launched our first cohort 4 weeks ago, had great companies who are staying in touch with each other and are working through challenges that they're having during the pandemic. So please feel free to check out our websites for the Pivot to Thrive Roundtables and meet business owners just like you. Again, thank you for joining us. Here are both of our websites for both our manufacturing center as well as our business center. Brandy Nagel is managing the Pivot to Thrive Roundtable, so feel free to reach out to her if you're interested. I have a couple more announcements with our SHE's group, our Safety, Health, and Environmental Services group. One is that we are working with them to be able to provide some discounts to companies who are connected to the MBDA centers and can get certificates. I think somebody sent me a question earlier. If this particular webinar is a certificate program, it's not, but we will be able to offer some discount to our companies through SHE's certificate programs that they have through the professional education program. And finally, we will have the consultations roundtable for Georgia companies. You can reach out to the SHE's group. Again, thank you so much. And recording will be sent to everyone who participated today. And Brandy, did I cover everything?
I think you did, Donna. We covered a lot of space in 2 hours, didn't we?
We did. This is pretty intense, packed information. So thank you again for joining us, everyone. Be safe. As our SHE's group will say, wash your hands, disinfect, wear your face mask appropriately, and more importantly, have your family and your employees stay safe and healthy. Thank you.